Good afternoon. We're happy to welcome all of you for a great seminar today from Cassandra Crifasi. Did I say that right? Okay, good. From Johns Hopkins University. She'll be introduced momentarily by our moderator, CJ. But before that, I'd like to just mention that the Health and the Public Interest Program is a master's program that emphasizes the non-medical factors that affect our health and healthcare system, including healthcare disparities and social issues, legal issues. And if you want to learn more about it, the website will be in our chat. And just a little bit about how the program will run this morning. Cassandra is going to speak for about 45 minutes after the intro, and then we'll open this up for discussion and questions, first from our students and then the more general audience, depending on the availability of the speaker. This can sometimes go until a hard stop at 1:15, but Cass, you can say, if that's possible or not. But meanwhile, CJ, the floor is yours.
Awesome, thank you. So I have the honor of introducing Dr. Cassandra Crifasi, who is an associate professor of health policy and management at the Johns Hopkins Bloomberg School of Public Health and co-executive director of the Center for Gun Violence Solutions. She's also a core faculty member in the Center for Injury Research and Policy and the Center for Health Disparity Solutions. Working in the field for over a decade, her research focuses on the intersection of public health and public safety, including injury epidemiology and prevention, gun violence and policy, and attitudes and public opinion regarding gun violence solutions. She uses rigorous evaluation methods, including difference in difference, comparative interpretive time series, and synthetic control modeling, as well as qualitative methods to assess the impacts of policies and programs on violence and injury prevention. Dr. Crifasi earned an MPH in Environmental and Occupational Health from the Dornsife School of Public Health at Drexel University and a PhD in Health Policy and Management from the Johns Hopkins Bloomberg School of Public Health. In her free time, she's an avid runner, as you could probably see with all the medals in her background, and she also really loves to crochet. And with that, I ask you all to join me in giving a warm welcome to Dr. Crifasi.
Thank you, everybody. I'm excited to be here. Let me reshare my screen. And if CJ, could you give me a thumbs up? Does that look right? Great, perfect. Thank you. So excited to be here today and to talk about some of the work that we are doing at the center. So just a quick outline. I'm going to start off talking a little bit about some of the data that we look at when we're thinking about firearm injury and death. Talk a little bit about some of the evidence-based solutions that we work towards. I'll talk a little bit about some of the research that we're doing, as well as how we are then translating that into advocacy and policy, and then save some time for Q&A and discussion. Really excited to hear the kinds of questions and comments that you all have today. So jumping in, I'm going to focus on data from 2022. And that's largely because just a matter of like a week or two ago, complete data for 2023 came out. And it often surprises people that it takes so long for us to have mortality data in the US. We're really good at counting lots of things, but we're really, really slow at counting mortality. There are some places in the US that still report on paper death certificates, for example. And so it just adds time to make sure we have complete information. And I'm largely going to be focused on fatal data because, again, when it comes to counting things, we're really quite terrible at counting non-fatal firearm injuries. And we can talk about that in the discussion if folks are interested. But in 2022, just over 48,000 firearm deaths occurred. More than half of those were suicide. The bulk of the remainder was homicide, and a small proportion of unintentional deaths, deaths that are referred to as legal intervention, which is how we classify sort of officer involved or police involved deaths. I will flag that 643 is a vast undercount. When you look at fatalities by shootings by police specifically, it's around 1,100 per year based on other data that we collect. So I do just want to flag that that's an undercount. And then these undetermined deaths. And you'll see QR codes on the bottom of the slide throughout. Those codes will take you out to the reports with the figures that I'm citing. I also shared a PDF of these slides that people can have access to if they're interested. One of the things also that when we're thinking about this issue that doesn't get enough attention is really the lethality of firearms and their exceptional design at doing the things that they were designed for doing. So when you look at the proportion of homicides and suicides that involve a firearm, it's quite high. Just about 80% of all of all homicides in the U.S. involve a firearm, and just over half of all suicides. And an important note: only about 6% of suicide attempts involve a firearm, but because they are so lethal, upwards of 90% of attempts with a firearm result in a fatality. We end up with more than half of completed suicides involving a firearm. And so it's a really important issue thinking about exposure and access to these exceptionally lethal means, both in the context of homicide and suicide. And on that note, in 2022, actually firearm suicides reached the highest number that we've ever recorded in the US, and it's been rising quite rapidly. The initial look that we've taken at the 2023 data so far shows that that number is continuing to increase. And so we're thinking a lot about how are we increasing some of our efforts on policies and programs that will address both homicide and suicide. And it's important also when we're thinking about the distribution of firearm violence, firearm injury, and death to get pretty specific for two reasons. One, if I say gun violence, people tend to think about different things. And so we often will focus specifically on firearm homicide, firearm suicide, mass shooting, shootings by police, sort of depending on the context, because when you get specific, it's a lot easier to find some common ground. But then also there are different distributions of these various outcomes by age and race, for example. So here you can see for 2022, the differences in the rates of firearm homicide by age and race. You can see that across every age bracket, Black Americans experience much higher rates of firearm homicide than white Americans. And particularly for our youngest people, those age 15 to 34, we see rates that are sometimes 30 times higher for Black young people than for white young people. And thinking about some of the structural issues that we have, some of the policy choices we've made that tends to concentrate both disadvantage and disinvestment in minoritized communities that can contribute to some of these high rates of violence. Things shift a little bit when we look at firearm suicide. So the rates are generally comparable for younger people when it comes to firearm suicide. When you look at Black young people and white young people in the US, but as you look at the older age groups, the rates among white Americans who are older tend to increase, while the rates among older Black Americans tend to decline until you get to the oldest age groups. And this is partially due, we think, to who tends to own firearms. Firearm ownership in general has tended to concentrate among older Americans. Having a firearm in the home increases the risk of suicide by more than threefold, again, because they are so lethal and that high case fatality rate among people who attempt suicide with a firearm. So if you own firearms and they tend to be owned more among older people, that is also contributing somewhat to this difference. I will note there's been a really significant diversification in gun ownership, partly starting during the COVID-19 pandemic. A lot of new firearm purchasers were women and other minoritized communities, and that has potentially starting to shift some of the distributions of firearm suicide, and we're tracking that over time. One important thing that I want to note, we have seen some significant and generally sustained increases in firearm homicide. I mentioned firearm suicide as well, but firearms homicide in particular, we saw a really significant jump from 2019 to 2021. Now, I'm not going to say it's 100% driven by an increase in firearm purchasing or firearm ownership. There are lots of things happening at the same time, but we know from years and years of research that exposure to firearms leads to increases in the risk of firearm injury and death. And so I want to take a minute to talk through this chart here and think about sort of what implications this might have. So for folks who are not familiar, NICS is the National Instant Criminal Background Check System. It is the federal system that is required to be checked every time you buy a gun from a federally licensed firearm dealer. And this chart shows the monthly checks across the US. And so sort of lots of little lines for each year. And there are a couple of key things that have happened over time that I think are worth mentioning. So from 1999, which is when we sort of first started to have this system, it sort of was coming into effect in the late 90s, and 1999 is really when we had this system. But from 1999 to around 2008, early 2009, we generally saw pretty stable counts. Some seasonal variation, which we tend to see with hunting season and other sorts of variation that occurs, but generally stable over time. In 2008, the Supreme Court took up a case, Heller versus the District of Columbia, which challenged Washington, D.C.'s handgun ban at the time. And it struck down the ban as unconstitutional, saying you can't broadly prohibit people in Washington, D.C. from owning firearms. But it also, for the first time, affirmed an individual right to gun ownership for self-defense in the home. Prior to this Supreme Court decision, it had been thought of as a collective right. We have a right to own firearms, really that militia context that's in the Second Amendment. Post-Heller, it was I, as an individual, have a right. So we saw many more challenges to longstanding firearm policies, but also we start to see a trend upward in firearm purchasing. And one caveat I want to make, these NICS checks, while a generally good estimate of firearm purchasing patterns, are not a direct correlation with sales, because depending on the state you're in, I could walk into a licensed dealer, undergo one background check, and walk out with 10 firearms. So really, this is checks, not purchases, but this is sort of at least gives us some indication of these trends. But you can start to see some interesting spikes. So we saw a spike in particular late 2012, early 2013. This is right after the Sandy Hook school shooting, when there was a lot of talk about federal firearms regulation. We saw a spike in 2016 when there were concerns that Hillary Clinton would win the presidential election and potentially pursue some firearms regulations. But often there's a spike and then maybe a normalization back down. And then we see in 2020 and into 2021, this big spike that we're largely attributing to COVID and the fears and uncertainty around the COVID-19 pandemic. We've seen that trend down a little bit, but we're really in this much higher rate of firearm purchasing. And it is people who own firearms buying more, absolutely, but we are seeing lots of people buying firearms for the first time during this time. Some estimates suggest in the sort of first 3 quarters of 2020, sort of the height of the COVID-19 pandemic in some cases, around 8 million people bought guns for the first time. Some of them may have bought guns anyway, regardless of the pandemic, but we know from survey data that many people bought guns specifically because of the COVID-19 pandemic. In follow-up surveys, we've also learned that people have bought guns since the beginning of the pandemic and for the 4 years moving forward from there because of concerns around political violence, concerns around racial violence, and wanting to be able to protect themselves, not just in the home, but in public spaces from various things that they might encounter. So I want to sort of orient us a little bit about there are lots of guns out in public spaces. And so I'm regularly asked, what can we do, right? There's more guns than people in the US, the horse is out of the barn, sort of how do we address this issue? And we really think about thinking about supply and demand. So there's a couple of different ways that we can address this issue. But it's also important, I showed you some variation in gun deaths by race and by age. There's also significant variation in firearm deaths by geography. So a really powerful visual that we show is this one. So this ranks the state by their firearm death rates. And there's some color coding so you can see intent. The light blue is suicide. The dark blue or black, depending on the shading that it appears to you, is homicide, and the orange is other. And I've added the national average line here. So if you listen to the news media around gun deaths and firearm violence and gun control, all these sorts of things, you would think that it's Baltimore and Chicago and New York and some of these urban areas that are responsible for so much of our violence. And that's really where we should be putting our focus. But if you look at the distribution, it's actually Mississippi, Louisiana, New Mexico, Alabama, places where they have fairly lax firearm policies where we're seeing the highest rates. And some of this is differentiated by homicide versus suicide. Montana, for example, really, really high rates of firearm suicide. So their problem may be slightly different than a place like Mississippi that has higher rates of firearm homicide. But I like to orient here because there's this perception that if we could reduce violence in these particular parts, these particular urban areas of the country that may be perceived as democratic or sanctuary or sort of whatever term you want to phrase, that we would magically eliminate the vast proportion of our firearm violence in this country. And that's simply not the case. Another way to frame this is if you look at Field and Stream or Guns and Ammo or some of the NRA guides, the places that are most gun friendly, that sort of pride themselves on gun rights, are the places where we have the most burden of gun deaths in the US. And this pattern follows pretty similarly with some minor variations. If you focus in on the youngest people with the greatest vulnerability for violence involvement, those age 15 to 24, we again see this pretty stark pattern where states with the weakest gun laws are on the left with the highest rates, and states with the strongest gun laws are on the right with the lowest rates. And I say this to say, again, I'm often asked, well, what can we learn from other countries that have done more, done better, done things differently with regard to firearms? And I say, sure, there may be some things that we can learn from them, but we actually don't have to go any further than our own country to look at what various states are doing to find interventions that are working. California, for example, is a great case study. In the 1990s, they would have been all the way over above Mississippi in terms of their gun death rate. But they made changes to funding gun violence prevention programs, put certain policies in place to allow them to better identify and screen out people who shouldn't have firearms. And now they're way over on the right with a significantly lower firearm death rate. So I'm gonna move on from this, but I just wanted to orient us to there are things that we can learn from states across the country, and that's really where our center focuses our time. And I'll get to some of those in just a minute. So I wanted to draw a parallel between something that folks probably experience and see a lot more. Probably most of us either rode in a car today or at least saw a car today. I would wager that a very small proportion of us saw a firearm today. Like, I personally own firearms and I didn't see a firearm today because they're all locked up in my gun safe. And so the exposure is very different between guns and cars. And we've made significant improvements in our motor vehicle safety, road safety, driver training, all of these things, such that even though we drive many billions with a B vehicle miles more now than we did 100 years ago, our motor vehicle death rate is substantially lower. We have cut it, down so low, and there are actions and activities now to get to zero. There's a whole program, Vision Zero. Can we get to zero motor vehicle deaths, and how do we achieve that? Which would have been unthinkable probably even 50 years ago. So there are things that we can learn from public health, learn from product design, safety training, all these things to help us make improvements. And I want to also note that when we think about young people, those age 1 to 17, firearms are responsible for more deaths than motor vehicle crashes, cancer, some of these things that we traditionally think of as being leading causes of death for kids. Firearms have been the leading cause of death for all kids for 4 years in a row now, but they've also been the leading cause of death for Black kids for even longer than that. And one of the challenges we have in gun violence prevention, which is a common problem in issues related to public health, unfortunately, it often doesn't get enough attention or the attention it deserves until it starts impacting communities other than our Black communities in the U.S. Thankfully, it's getting more attention now, but this has been a longstanding problem that more and more people are now paying attention to. And the last thing I'll note in terms of data before I talk about sort of what we're doing about some of this stuff, and I like to talk about all the terrible stuff and then talk about what we're doing about it to leave people hopefully feeling slightly more optimistic than you might be feeling right now. But I do want to note that among young people, kids and teens, age 1 to 19, the gun death rate for that group has increased by almost 90% over the last decade. So we are seeing significant increases in this issue, again, among our most vulnerable groups. And if you're thinking about lost wages, years of productive life lost, productivity, all of these things, and we're thinking right now a lot, regardless of your political affiliation, probably thinking a lot about the economy right now. And one of the worst things that can happen for the economy is to have young people dying. And so we need to be making sure that we are attending to this leading cause of death for kids and teens. Okay, so I'm going to talk about these 5 solutions that we focus on. And I orient it this way. I'm going to talk a little bit about some of the research. I'll talk a little bit about some of our advocacy efforts. But we can save a lot of this for discussion because I get tired of hearing myself talk for too long, and I want to make sure that we get to a point where you all can be engaged. But we have these 5 solutions, and I'm going to sort of talk through them each a little bit. So one of the primary areas that we focus on is sort of guns in public or the public carry of firearms. This could be open carry at demonstrations and rallies. This could be how states regulate concealed carry. And this is a topic that we've been working on for well over a decade, thinking about the rules and regulations and requirements if someone, for example, wants to carry a concealed firearm in public. And our research has found that when you have high standards and you have sufficient training and background check requirements, you actually see fewer harms than if you make it really easy for people to carry in public. And there's generally 3 ways this has been regulated. May issue, meaning you have to apply, get training, meet some objective criteria, but also law enforcement has the capacity to deny you if you don't have a good and substantial reason for carry. A lot of concerns around that. The recent Bruin case at the Supreme Court addressed this and actually struck down that discretionary element. There were concerns about whether it was being applied fairly, equitably, et cetera. The second bucket, shall issue. Generally, there's some application, background check, sometimes training. And again, you meet some objective criteria, but then you get the license. That's the key difference between may issue and shall issue. But over the last 15 years, we've seen a shift towards what we call permitless carry, meaning I can legally own a gun and therefore I can carry it in public without any kind of background check, permit requirement, training, anything like that. And this is where we see really significant harms. We see increases in crime and violence, increases in shootings by police, and decreases in arrests for illegal weapons possession, because it's a lot harder for people to determine whether you can lawfully have those guns in public or not. One area that I'm particularly excited, we developed a virtual reality system where we are running gun owners through this system to understand if it's a feasible tool for understanding decision-making and behaviors, and as a way to potentially inform training, do an additional assessment for folks before they may choose to carry in public, particularly in the context of places that may have space requirements. They might not have ranges. They might not have places where you can actually do some training on decision-making. We're also in the process of writing a model policy guide to help states who are considering strengthening or even retaining their concealed carry licensing system, or they want to address their open carry system. We're making recommendations on what the best practices are and what research says, getting that into the hands of advocates and policymakers. The second big bucket that we focus on is community violence intervention. This includes things that you might traditionally think of, like the Cure Violence model, which is violence interruption and social services support, case management. We also support hospital-based violence intervention, which moves it out from the community and into the hospital to the bedside if someone sustains an injury, and using that unique clinical opportunity to engage people in a program. But we've also developed a public health, public safety partnership called the Violence Reduction Council that brings data together with a variety of partners, including community members, to understand the data, see what's happening in their community, and co-create solutions and make recommendations on what can be done that are consistent with what the community wants to see happening, rather than relying solely on policing or other criminal justice interventions. And we have a training and technical assistance center right now where we're supporting about 15 cities across the country who are implementing some sort of a violence reduction council to help address violence in those communities. Safe and secure storage. This is an area where we're focused both on policy and behavior. So we've done a lot of research evaluating safe and secure storage laws, child access prevention laws. They're called lots of different things. And we found lower rates of child and adolescent homicide in states that require child access prevention. That means gun owners can't leave their guns out in places where they think kids might gain access to them. Some of them have more specific storage requirements. We have some CDC and NIH funding right now to do safe storage counseling in the hospital at the bedside for adolescent and adult patients, helping them understand the importance of safe storage, providing them with gun safes so that they can actually then take that home and operationalize this. And we do a lot of messaging campaigns around the importance of safe storage, not just for reducing injury and death in the home, also reducing theft, which is a significant source of guns into the underground market. And we are finalizing a model policy guide where states can adopt some of these stronger recommendations that are associated with more beneficial effects, and distributing that out to, again, policymakers and advocacy organizations who are working to address this issue. Firearm removal laws is a large bucket that really covers two policies that we are focused on. One is domestic violence related firearm removal, and the other is extreme risk protection order or red flag firearm removal. And on the domestic violence area, we're thinking about individuals who have become prohibited because they are subject to a domestic violence protection order or domestic violence misdemeanor, and training judges and lawyers and other practitioners to properly implement that removal process. Because when a domestic abuser has access to a firearm, their female partner is 5 times more likely to be murdered. And so making sure that limiting access during that time is important. Extreme risk protection orders or red flag laws is, again, a civil process like domestic violence protection orders, but it allows law enforcement, family members, sometimes licensed healthcare providers to petition the court to temporarily separate someone from their firearms during a time of crisis. And often this includes a connection to services, making sure that the person who is going through that crisis or elevated risk can get what they need to get through that time. And we are the Training and Technical Assistance Center also for extreme risk protection orders. So every year we're training thousands of lawyers, judges, police officers, domestic violence, and other victim services groups to make sure they know how to effectively use these tools. And the best thing about working on both of these projects is we can learn from the domestic violence space to inform the extreme risk protection orders and vice versa to make sure that we're properly implementing all of these policies. One of the biggest challenges to policy work and policy evaluation, a law on paper doesn't do us much good if it's not being used. And so making sure it's being used properly, that way when we evaluate it, we can understand whether it's working or not based on how it's being used. And the final policy that I want to mention is permit to purchase laws. Sometimes we call them firearm purchase or licensing laws. These are laws that require somebody to get a license before buying a gun, just like you would get a license before you bought a car from a dealer and drove it off the lot, right? Separating the can you legally drive from driving a car, just like you would then separate can you legally buy a gun from the actual act of buying a firearm. It increases accountability. And we've done tons of research on this policy. It's the primary one that I've spent my career researching. And this is a policy where we see impacts on multiple forms of violence. So we've found reductions in homicide, including mass shootings, suicide, reduction in diversions for guns for use in crime, lower rates of shootings by police, lower rates of police being shot by civilians. So pretty much every outcome we've looked at, we're finding protective effects, lower rates of domestic violence, homicide as well. And this is a policy where we just released a report in partnership with the Consortium for Risk-Based Firearm Policy, talking about these, and we're now currently working on a new model policy guide, again, to support. This is an area where we've done a lot of research translation. So we supported the ballot initiative in Oregon in the 2022 election that resulted in their adoption of a permit to purchase law. We did a media tour, we did research translation, we talked with news outlets, et cetera, and they were able to pass this law via ballot initiative. And we also supported the passage of this law just this past year in Delaware and are now supporting their sort of scale up and implementation. So really excited to share with you at a high level some of the work that we're doing, some of the advocacy efforts that we have. I want to pause there and see if we want to open it up for discussion. I could keep talking at you for a while longer, but I think it'll be more interesting if I get a chance to hear some of the things that you are eager to talk about. So I'll stop sharing for now. I can bring these back up if anyone wants to look at something in particular, but happy to answer any questions.
Okay, thank you so much for that. So yeah, we'll move into the question and answer portion of the seminar, and we'll start with any questions from the HAPI students, and then we'll open it up to the public after that. Feel free to use the raise hand function or to put anything in the chat box in terms of questions. But it looks like we have a student question. Callie, go ahead.
Hi, thank you for this presentation. It was really interesting. See. Sorry, I think my Wi-Fi went out for a second. But my question is regarding that last piece that you were showing us and how you're saying that it clearly has been effective. So what are some of the biggest, what are those who are opposing it, community members and policymakers, what is their reasoning for saying that they wouldn't want to adopt something like that?
Yeah, that's a great question. So what we hear most commonly is that we don't license or permit any other right. So why would we do that for firearms? Which is wrong. You have to get a marriage license. You have to register to vote. You have to submit a permit application to have some kind of protest or rally or demonstration. And so it's sort of a false argument that people sort of easily fall sort of fall down that trap, as opposed to just sort of rejecting the premise of the issue. But more commonly, we hear about it's overly burdensome, it's overly costly, and gun owners don't support this because it's an infringement on their rights. And so what we've done a couple of things. We've looked at cost, and there are some states that are probably overly costly in what they do, but the vast majority just simply offset the administrative burden. So what does it cost to process a license? That's what we're going to charge for the application fee. Second, we do biannual public opinion polling. I'm super jazzed because we just got our 2025 data, and I'm excited. We're digging into it now to figure out sort of what the current support is. But our most recent survey was from 2023, and about 62% of gun owners support requiring people to get a license before they buy a gun. And actually, if you ask gun owners who live in states where these policies are already in place, it's upwards of 75%. So I think there's a little bit of uncertainty with the unknown. We don't know what this is going to be like, so we're going to oppose it. But we have generally been effective at addressing some of those concerns. And I think this is an important piece for students to learn regardless of the topic that you're in. While it is not necessary that you agree with people who have a different perspective, it is absolutely necessary that you understand that their perspectives different from your own, because that's key to crafting effective counter arguments. Like, if we don't talk with people who don't agree with us, we're never going to understand the sticking points to then be able to gather the data or craft those messages to try to convince them. Some folks may never be convinced, but other folks may be, with the right message that's responsive to their concerns. I don't know if I answered your question, Callie. Yeah. Okay, cool.
Okay, we will go with Aubrielle next.
Hi, thank you so much for coming to speak with us today. This morning, the New York Times posted a story of a teacher who had survived the Sandy Hook shooting, and she had described all of the advocacy work, but particularly the emotional support work she had done with the students who had also survived, and how that had lasted years and years after the shooting. And my question is, does your research involve any of the emotional components after communities have experienced gun violence? And what ways can policy support providing survivors of gun violence or those who are affected by it?
Yeah, excellent question. So we are working on that topic in a couple of ways. So one, we have a whole team of licensed healthcare providers in our center. They're part of the clinical programs and practice team who work with victims and their families, survivors of gun violence, and trying to help sort of meet those immediate needs. So on that sort of service provision side, connecting them with supportive services, mental health services, understanding that it's not just a physical wound, but an emotional wound that may impact people beyond just the individual who's in the hospital. So that's sort of the more concrete service delivery side. We also are working closely with our community violence intervention programs to evaluate, do they have the kinds of mental health services that these individuals need? Often, unfortunately, the answer is no. And so we're helping them craft grant applications to be able to hire social workers or other mental health providers to attend to that particular issue. People will often say, oh, we're taking a trauma-informed or a trauma-based approach. But what that means often, it doesn't actually translate into what the best practices would say in terms of trauma-informed. And so working to help those particular programs. The last thing that I'll mention, I talked about the violence reduction councils and how we're implementing this in various cities. One small piece of that, we have a new grant that is looking at what technically are mass shootings, but don't get defined by the media as mass shootings because of the populations that they occur in, and thinking about how we can pull together a sort of critical incident response and crisis response for mass shootings that are occurring in predominantly Black and Brown communities and get treated as often isolated events or criminal activity as opposed to mass shootings, and making sure that there are processes that are developed in those communities to connect people to services, to bring things in, a little bit like what we might have hoped for as a FEMA response to some kind of environmental catastrophe. Can we bring that kind of strategy to these mass casualty incidents and really get people the help that they need? So those are some of the examples of the work that the center is doing. From a policy side, there's lots of opportunities to advocate for increased funding, opportunities to use things like Medicaid or other private insurance to support the social and emotional well-being of people who are victimized by gun violence, but also their family members, making sure that survivors' family members also are able to use their insurance to access some of those resources. So that's a particular policy lever that we're pulling also.
Okay, next we'll go with Michaela.
Hi, thank you so much for your presentation. It was super interesting. I had a question kind of on what can we do as students to get involved with advocacy for this issue or working towards to alleviate the issue.
Yeah, that's a great question. And the one of the best things that you can do is go testify in front of your state legislature when there are bills that you support or that you don't support. There is sort of this disconnect that we see between breadth of support. We see lots of policies have really broad support, but we are lacking often the depth of support, people being willing to be activated to go do a thing in support of it. And we often hear from policymakers that they base their decisions on the 3 C's. Constituents, what are their constituents telling them? Their colleagues, what are their colleagues asking them to do? And then their conscience. And they never want to have to make a vote based on their conscience, so they'd rather do something based on the other 2. And we will hear, particularly in smaller jurisdictions, one phone call might be the difference in what a policymaker chooses to do. And so activating your voice, calling your policymaker, writing letters, showing up to testify, whether it's written or oral testimony, can make a huge difference in the decisions that your state or federal policymakers are choosing to make. And so that's a really great way. There's lots of good advocacy tools. We have the Center for Public Health Advocacy at Johns Hopkins. Your institution may also have some advocacy training, but helping you to craft that pitch, making it clear that you support or don't support whatever it is that you're there to testify on. But often people feel like, what can I do as one individual? And showing up and using your voice is the most powerful thing that you can do.
Hannah?
Hi, thank you for your presentation. Earlier, you mentioned a high prevalence of firearms in vehicles. So I was wondering what you thought about road rage related gun violence and if it's an issue of increasing concern and what sort of strategies or solutions you discuss could be implemented to reduce the occurrence of it.
Yeah, great question. There have been increasing reports and increasing research studies examining not just sort of guns in cars generally, but road rage specifically. So I think there are 2 issues when it comes to guns in cars. One, as we make it easier for people to carry firearms in public, there will be more people armed in cars or just leaving guns in cars, because there are still lots of places people can't legally carry, like places where alcohol is served or concert venues or sports stadiums, et cetera. And folks who want to illegally acquire firearms have gotten really smart. You go to these big parking lots that are often unattended. You lift enough car door handles, you're going to find one unlocked. You find enough unlocked cars, you're bound to find firearms that are left unsecured. So there's one side where our center is working really hard to promote and require safe firearm storage in vehicles, making sure that your car is locked, that the guns are locked up separately, preferably in some kind of hard-sided container, and stored out of sight. Often people will steal firearms as a crime of opportunity out of cars. And if they can't see the gun and your car's locked up, chances are it's not going to get stolen. And so that's one particular side. The other side is more directly related to your question on the road rage piece. And we have been seeing increasing concerns, increasing reports of this. And so far, the response has been not just lackluster, but like potentially not helpful. So a lot of law enforcement perspectives are like, basically, well, you get what you pay for. Like, we made it easier for people to carry guns in public. And so, like, people have these guns and they get pissed off on the road, and now they're going to, use them in these road rage incidents. And so it's about two things, I think. One, better training about when it is and isn't appropriate to use firearms, and also thinking about putting back into place some of the criteria that we have lost in some states, where those training requirements are actually there, and then holding people accountable when they do use their firearms. An additional piece that is particularly challenging is the expansion of what are called stand your ground laws. If you are in your home, there's a thing called castle doctrine. I'm in my home. It is my castle. I can use lethal force to defend myself and my home. Stand your ground laws extend that right outside of the home. In the absence of these laws, if someone is threatening me, my primary duty is to try to remove myself from that situation in some way. These stand your ground laws say, Cass, if you're feeling threatened, you can defend yourself, including using lethal force in the perception of this threat. So easier to carry guns in public, and authorizing people to use lethal force if they feel threatened. That's leading also to some significant increases. And so addressing these stand your ground policies, repealing them, is going to be important, particularly because we find the people who are allowed to use stand your ground as a defense has a lot of racial bias. It is far more successful to use stand your ground as a defense if you are a white defendant than if you are a Black or other minoritized group defendant. And so it's translating to additional inequities throughout the criminal legal system, as well as violence victimization.
Next, we'll go with Katie.
Hi, this has been really interesting. I know that you mentioned earlier that you worked with different states and legislatures to get laws passed. And so I was just wondering if you could explain like how that process generally works. Like, I'm sure it's different for different states, but like, are you guys generally actually crafting the policy, or are you there as more of just like a supportive database for them to kind of draw on?
Short answer, yes. We sort of do as many things as is helpful. So although more often than not, we are not very directly writing the specific legislation, we think that that's important for the local policymakers, the folks who have that more local context to do. Although we have been creating these model policy guides that have examples of the components that are important to incorporate. But we will often meet with advocacy organizations and policymakers to talk about the strengths and weaknesses of a particular bill. We will translate the research so that when the sponsor of the bill, the policymaker who wants to put it in place, or people locally who are going to testify, they have the best available evidence to talk about why this policy works, sort of what the strengths are, and also some of the unintended consequences to avoid through this policy. We will sometimes go testify ourselves if we think that there is sort of particular benefit. So, for example, I'm from Washington State originally, and they're considering passing a firearm purchaser licensing bill right now. So while I don't currently live in Washington, it holds a special place in my heart. My whole family still lives there. And so I will regularly go testify on these firearm bills, talking about why I care about Washington and then the expertise that I bring. So that's sort of another piece that we will do. And we have a whole team. Like, please don't take this to be that like Cass is doing all of these things on her own. We have 35 full-time staff. Most of them work on policy advocacy or implementation. And so they're doing a lot of great work. And one of the best things about doing this kind of work that informs policy is that these policies then inform our research, because we will be asked questions about the policy that perhaps we hadn't thought of that can inform the research questions that we go ask.
Dr. Myers?
Cass, thanks so much for this talk. I appreciate very much that you stayed away from sort of the common things that we hear about right to possess guns in the U.S. compared to other places, and all of the things that relate to what you said about the horse being out of the barn, right? That you're focused on things that can look at the situation the way it is and work to reduce gun injury and death. I have a question, thinking like a population biologist. If you look at guns, and you talked about how we have more guns than people in this country, what's sort of the half-life of guns when they get out into the environment? Is there anything that's done besides, the kind of, bring your gun to the police station efforts that take place once in a while? What's done in that area, and what's done in the area of trying to understand sort of the pathway of guns through the environment? I mean, we hear things in DC about how many of the guns come from West Virginia or Texas or whatever. But anyway, I'll let you take it from there.
Yeah, no, that's a great question. So, a couple of things in response. Traditionally, like on average, from the time a gun is purchased until it makes it in a crime recovery, it's about 12 years. There are lots of guns that are never recovered in crime, and there are lots of guns that are recovered sort of in a shorter amount of time. But on average, from the time a gun is purchased, if it's going to show up in crime, it takes about 12 years. Now, in terms of a half-life, guns are exceptionally durable. If they're even like moderately or barely taken care of, they tend to fire because their mechanics are pretty simple, and they haven't evolved a ton. So what that means is all these new guns being purchased, it's not like they're replacing old guns. Often we're just getting more of them. And it's not like a refrigerator or my dishwasher that's complaining at me right now and groaning every time I use it and like, oh, it's 6 years old, maybe I need a new one. Like it, people can pass them down and they can last a really long time. So how they're owned and stored and used becomes really important because they're not usually going anywhere. In response to the buyback piece, there are some pros and cons. So some of the pros, people who have firearms and don't want them can dispossess themselves of them. There are lots of companies that will take guns and melt them down and turn them into other things. Some of these buyback programs will also certify destruction. Some of the cons, not all of them certify destruction. So some buyback programs have actually then turned around and sold those guns, and then they are right back out into the hands of folks rather than limiting the stock. Sometimes the guns that are acquired through these are not the kinds that are being involved in crime. These are older, sometimes non-functional, and not the ones that we're thinking about people wanting for concealability, high caliber, that kind of stuff. The big concern that doesn't get nearly enough attention with these programs is often they are turned in with a sort of no questions asked policy, which on one hand is good, right? You don't want people discouraged from turning in a firearm if they acquired it illegally. But it also, we've seen increases in robberies and sort of theft from homes and cars in the areas around these buybacks, sort of in the days leading up. Because if I can find a couple of guns to steal and go turn them in, no questions asked, and they're giving out $500 per firearm I turn in, like it's a pretty good economic investment to sort of for that time. So there are some pros and cons to it, but there really hasn't been any kind of substantial sort of larger level effort to allow people to either turn in guns or to dispossess people. And I think that largely comes back to folks being sensitive to the regular rallying cry that any kind of effort to have policy or restrict ownership among people who shouldn't have guns is like the first step in taking everyone's guns away. Like I mentioned, California, they put lots and lots of policies in place to address gun violence, to better regulate them, to make sure they can take guns away from people who have lost the right to own firearms. There's never been any kind of mass confiscation, but that tends to be a data point that folks like to ignore. So I don't know if I directly answered your question, but or if I missed a piece at all.
No, that was great. Thank you.
Okay.
I'm also going to really quickly, I'm going to drop my email in the chat. So if anybody has follow-up questions, I know we still have time to chat, but just in case anybody has a follow-up, they can email me also. Sorry, CJ, what were you going to say?
Yeah, no, you're good. You're good. I actually had a question of my own before we open it up for everybody else. I was just curious if you could talk a little bit about your personal journey, just like into the topic of gun violence and kind of what inspired you to go into this space.
Yeah, so I had a very non-linear path into public health generally. I had wanted to be an orthopedic surgeon, played a lot of sports, did a lot of running, got injured a lot, and I thought it was really cool that you could fix people after they were injured. Unsuccessfully applied to medical school and was very nicely referred to the public health program at Drexel. Had no idea what public health was. I was like, food poisoning and clean water. Like that's really all that came to mind. But I thought, what the heck? Master's degree in public health, that should definitely help me get into medical school. Let me give that a try. And within the first week, I heard two different lectures that really changed my path. One, I heard a lecture on injury prevention and was like, wait a minute, you can keep people from getting hurt in the first place. That's really cool. And then I heard a lecture about policy and how policy could be a population level tool to advance the health and well-being of the communities that you're interested in serving. And so that was a big shift for me. Then I went to Hopkins to do my doctoral training and had intended to look at occupational safety and health. That was my master's degree. I had spent time working as a nurse's aide and, wanted to sort of help make the workplace safer. And while I still do a little bit of workplace stuff, it's mostly in the context of violence now. But I was a little hesitant to enter the field of gun policy, gun violence research, not because of anything at my particular institution, but hearing the common refrain about, public health just wants to take your guns away and nobody can have any kind of rational discussion about this and nobody agrees on anything. As a longtime gun owner, I was concerned about sort of what I might be able to contribute. And in talking with some of my mentors, I realized that I brought a different perspective. There are not a ton. I mean, it's not like I'm the only one, but there are not a ton of public health researchers studying gun violence prevention who also not just own firearms, but like actively shoot for sport. And so I realized that I could perhaps bridge some of the gaps or connect with people differently. And that has actually paid off a lot. We've done focus groups and interviews and lots of projects with gun owners. And it's helpful for me to say, this is about us having a voice in the solutions that are being discussed for gun violence prevention, right? If we want to truly be part of the solution, then we need to contribute to research. We need to contribute our perspectives. And that has shut down a lot of, you just want to take my guns away. You're at the Bloomberg School of Public Health. Like, you got Mikey B on speed dial and he's gonna, you can call him up and get funding for whatever you want to do. But that has really shaped a lot of the research questions that I ask and how I then translate that, how I talk with policymakers and advocates. And I think it's really important as public health researchers, as sort of whatever kind of work, whatever kind of practitioner you might be moving forward, that it's not about telling people what not to do or telling people what to do. It's about how can we co-create these things or how can we lift up things that folks are already doing and make sure that that's the narrative that is being talked about. So that's sort of a longer than short, but short-ish version of my trajectory.
Thank you. Thank you for that. So I don't see any more questions from any HAPI students, so we can go ahead and open this up to everyone else. There are a few questions in the chat. I'll start with the first one from Jenny. It's a comment and a question. So she mentioned that a while ago, she read a psychology research study where participants including law enforcement, were statistically more likely to shoot unarmed Black characters in a virtual shooting simulation exercise compared to armed and unarmed white characters. And she was just wondering if you could talk about how your work to educate law enforcement and other groups incorporates the racial components of gun violence.
Yeah, that is a really great question. So we are often talking about not just these disparities, these differences, but some of the drivers of these differences. So we have a really large body of work where we are looking at fatal and non-fatal shootings by police to help inform where are their gaps in understanding and where are their training opportunities. And so we have been working on thinking about mental health related issues, because people who are sort of interacting with law enforcement related to mental health or behavioral health concerns tend to be killed more often in interactions with law enforcement. Sort of they have a higher case fatality rate than people not experiencing mental health. Same with people experiencing homelessness. So I think there are lots of bias issues here. There are folks, not our group, but there are some folks who are doing like unconscious bias or implicit bias training. And while I think there is some opportunity for that, I think we also need to make sure that we are not sort of thinking that these policies are sort of enough of a solution to the problem. We are focused less specifically on training law enforcement in their specific activities broadly, but we have done a lot of work with adolescents. So how can we make sure that when law enforcement are acting or interacting with adolescents, are they doing so in a way that is sort of attentive to adolescent development, including developing a training that specifically has youth come in and talk to law enforcement about what it's like for them to interact with law enforcement, the concerns, the fears that they have, trying to put a face or a story to what they might be hearing in terms of the data. That's another piece that I can't emphasize enough. Data alone is often not enough to compel people to do things. It's got to be paired with something that folks can connect to. So if you're talking with a policymaker or someone, making sure you've got a story from their local area is really important. And then when we're thinking about the Violence Reduction Council piece, that's often thinking about, we try to shift the focus from race to place. Like, what are the structural issues that contributed to this violent event, and not saying, oh, this was a young Black person, so obviously that's why they were shot. Well, it was a young Black person in a situation almost entirely outside of their making or outside of their control. So how can we bring that to the conversation and change the way that law enforcement is looking at some of this data? So I don't know if that was like a super specific answer to the question, but those are some of the things that we're working on.
Okay, we have another one in the chat. This is from Mr. Mitso Tamita. Suicide in the elderly is higher than in youth, and speculation is that this is due to progressive, incurable, and eventually fatal conditions such as like cancer or dementia. And the question is, do you have any information or speculation on this?
Yeah, so we have long been concerned in particular about dementia and firearm ownership. Our center and some other folks at University of Colorado have done a lot of work thinking about firearm life plans. What happens if an individual, if someone is told by their doctor, maybe it's time for you to not drive because of some physical or health condition, then we're working with gerontologists and other licensed healthcare providers to think about what they need to be able to talk about potentially removing firearms from the home also. Because we have seen far too often someone experiencing dementia injuring or killing a family member or a friend because they're unsure about, or sort of, having some confusion or some issue with their dementia in that moment. And so thinking about ways that you can make firearm safety part of that patient-centered counseling, whether it's young people at risk of self-harm or older people who may have elevated risk. We've also heard some, we haven't done work on this very specifically, but we have heard some, people who get fatal diagnoses without a lot of time left to live don't want to be perceived as a burden on their family and may attempt suicide. Very directly related to firearms. I haven't worked in that space specifically, but certainly I think there's probably more evidence than speculation on that.
Okay, and looks like we have another one in the chat. Any information regarding Hispanics and Asian/Pacific Islanders?
Yeah, so in general, I presented data just on Black Americans and white Americans on some of these strata because the rates are significantly higher, but we are seeing alarming increases, particularly in firearm suicide among Asian American and Pacific Islander populations. I think partly this is due to the diversification of gun ownership that I mentioned. Traditionally, gun ownership among Asian populations has been really, really low, Hispanic populations as well. But we've seen increases in gun ownership among these groups, increased exposure. We're seeing that translate into suggested increases in mortality outcomes also. So that's something that we are continuing to keep an eye on. I will also mention that Native American populations often don't get discussed, and they have exceptionally high rates of firearm suicide. And so we have partners in our Center for Indigenous Health who are working very specifically on firearm suicide among that population also.
Okay, it looks like we have another one from the chat from Mr. John Grogan. Dr. Crifasi, can you spend a minute or two to compare, contrast USA with international experience of others in terms of gun violence, such as maybe Australia, Canada, or any that you may know about?
Yeah, when we think about sort of economically peer countries, our rates of firearm death are like 25 times higher than those other countries, even though our non-firearm death rates are virtually indistinguishable. So we do have much higher firearm access and firearm suicide and homicide as a result. There are some countries that have closer rates of ownership than we do in the US, but those countries tend to have very different processes for ownership. Like in Israel, for example, lots of firearm ownership. They also have compulsory military service, and they have a very rigorous licensing regime that has to be renewed regularly. And so it's sort of a little bit harder to make comparisons. Canada is probably one of the closer comparisons. They also, though, have much more rigorous policies and lower rates of death than we have in the US. Australia, New Zealand, Scotland are unique examples where they have experienced mass violence, mass shootings in the way that we continue to experience, and they had a very different reaction to those, either banning particular kinds of weapons, doing buybacks or confiscations, and they have not seen the same continuation of mass shootings and mass violence with firearms that we continue to see. I'll make one sort of flippant remark. I don't know if anybody reads The Onion, but there's a great piece that The Onion releases every time there's a high-profile mass shooting that's like, I can't believe this happened here again, in the like only country that doesn't do anything to address the problem every time it happens. So it sort of it continues to be an issue that we sometimes are having a really hard time addressing because of perceived political issues. And I will say, gun policy and gun violence prevention, in my experience, tends to be most political among policymakers. But when you actually ask people about what they want their policymakers to do, we see really broad support. We see broad support for comprehensive background checks, requiring safety training for first-time gun purchasers, requiring people to get a license before they carry guns in public, and passing a test to make sure they can safely and lawfully use them. So we have pretty broad support. Our challenge is, one, activating people to do something with this knowledge, and two, then getting our policymakers to do something that is evidence-based to reduce violence, not just responding to what the gun lobby may be pushing as a solution.
Okay, looks like we have time for maybe one, maybe two more questions. This one is from Mr. Keenan Zamore. Can you speak about the pros and cons of making firearm injuries reportable to public health? Some states, like Washington, have done this to improve surveillance of non-fatal injuries.
Yeah, that's a great question. The CDC it was called Faster Firearm Injury Surveillance through the ER. It has a new name now, and I'm just really abysmally bad at names, so I can't remember the new name. But they've sort of evolved this, and it is like a syndromic surveillance system to track these injuries. And they have been doing a really great job of getting this data in real time. And the challenge has been getting more states to participate. And I personally can't think of Thank you, Keenan. I can't think of very many cons to this. Like we are really good at counting all sorts of things. There's no reason that we shouldn't be better at counting firearm injuries. But we continue to, for the large part, base our non-fatal firearm injuries on a sample of hospitals, as opposed to doing this true syndromic surveillance. So I would have said I'm really optimistic that this would continue to expand, but without going too far down a rabbit hole, I'm not sure what the next 4 years will bring and what kind of resources will be available to continue expanding these kinds of projects. I'm hopeful that states will take up the charge, but again, there may be some differences in which states participate versus which states might not.
Okay, I think we do have time for one more. This is from Miss Kim Witzak. Curious if your center have any thoughts on the mass shootings and possible link to psych drugs. The government has never held hearings on violence, but did on suicide.
I have people in my center who are way smarter on this topic than I am, so I'm going to punt this one and say, if you're interested, send me a follow-up email. I put my email in the chat, and I can follow up with the psychiatrists and other mental health folks on our team who I'm sure can answer this, but I'm not going to embarrass myself by trying to attempt an answer to it.
So, Cass, I want to, before CJ closes us out, thank you again for a great seminar and just as great discussion. I think gun violence, as you're well aware, is something that public health people and programs aren't always, it isn't always the first thing on our minds, although it's a huge preventable cause of death and injury. So thanks for doing this and for your enthusiasm for doing this. And with that, I'll turn it over to CJ to close it out.
Yes. So on behalf of the Health and the Public Interest Program, I just really want to thank Dr. Crifasi for joining us today. I think I can speak for everyone here that we really enjoyed your talk and learned a lot about gun violence and gun policy. And I also want to thank everyone who joined us and wish everyone a great rest of their day.
Thanks for having me. I just have to say, I love the name of your program, and it made me so happy every time you referred to the HAPI students. So I just appreciate the chance to be here. Please don't hesitate to reach out. I'll drop my email in the chat just one more time in case anybody missed it, but always happy to chat.
Thanks for coming, everyone.